Education is our only way out. New drug prevention videos highlight dangers of fentanyl, cannabis, and vaping. San Diego Union Tribute. County Office of Education launches online video series, I Choose My Future, to help young people choose the future without drugs. County education leaders on Tuesday announced the release of a series of drug prevention education videos hosted by former DEA agent, special agent, and featuring talks by other local experts. We got another one in the news, fellas. The free videos posted on the County Office of Education's website seek to expand the drug prevention efforts that up until now were only done in person by Rocky Huron, who became the county's drug abuse prevention ambassador after retiring from the DEA. The idea is to make an I Choose My Future program available to more people. So not only was he able to siphon off a complete career from the taxpayers, now he's retired and able to siphon off another check from the taxpayers with this program. So anyway, education officials gathered with the Randy Children's Hospital pediatrician and County District Attorney Summer Steffen to announce the launch of the video at a press conference at the Coronado Middle School. The video was released pegged to Red Ribbon Week, a national drug prevention effort that began in 1985. We still do Red Ribbon Week. Are we serious? We still spend money on that?
I think so.
That's crazy. Anyway, Heron tells students that drugs today are stronger, cheaper, easier to get, and more socially acceptable than ever before. So they need to be prepared if a friend asks them to use it. His talks include a mix of personal anecdotes from his DEA days, photos of overdose victims shown in an emotional slideshow, and lots of facts. I actually will dispute all that, but the last part I really definitely dispute. Uh, he is he is the host of 6 online videos, which range in length from 11 to 22 minutes. Stefan and Dr. Natalie Lamb of the Randy's Children's Hospital pediatrician and UC San Diego assistant professor both appear in the videos. I believe the primary prevention education is our only way out, said Huron. That almost sounds, I believe primary prevention education is our only way out. That sounds almost exactly like the DARE tagline. I'm saying like almost identical. You just basically switched out a few adjectives and nouns. That's it. Anyway, um, we have to teach our future generations of kids not to surrender themselves to the harms of a substance. Now, like that is 100% true, and even true within cannabis. Like, children should not use cannabis unless they're medically prescribed to do so. But when you lump in cannabis with all these other dangerous drugs, when you say, "Oh yeah, we have to stop kids from doing fentanyl and cannabis," like you add that in, it doesn't equate. So I don't know. I'm getting off track. My bad. So Paul Goldhain, the county superintendent of the school, said Huron's presentations resonate with the audiences. They That's why the county decided to amplify his message and spend a bunch of money by creating videos that could easily be shared with teachers as well as parents and caregivers. The problem is there's only one Rocky. Oh, shucks. So how do we scale and make sure that all the kids have the information that they need and deserve? So the San Diego County leaders declared fentanyl a public emergency in 2022 after a sharp rise in fentanyl overdoses from 148 in 2019 to 812 in 2021, including a dozen victims under the age of 18. Among the deaths recorded by the Medical County Examiner's Office was a 24-week-old fetus that died and the child's mother who overdosed from fentanyl and Xanax. Uh, Officials said illicit pills often contain a deadly dose of fentanyl, powerful synthetic opioid that is similar to morphine, but is 50 to 100 times more potent. The medical examiner has seen a leveling off in cases for 2022. 791 accidental fentanyl overdoses have been recorded so far, and officials have said that could reach 815 when the cases are finalized. Six of the deaths were victims under 18. Every week, Stefan said she talks with a parent who has lost a child to fentanyl, some who discover that their child's bodies. The image of looking a parent in the eyes and seeing it'll never go away has driven our team to continue our strong prosecutions against greedy drug dealers. But prosecutors but prosecutors occur after a death has prosecutions occur after a death has occurred, while drug education prevention actually prevents the death, she said. And she believes the videos will be transformative and underscore the message that one pill can kill. And then this is where we go right in. Like, you hear all that, right? You hear all this death, destruction, fentanyl, murderous stuff, and then it ties you right into cannabis. Here, there's no segue, there's no title change, there's nothing. Cannabis overdoses are also a concern. Since 2016, Randall's Children's Hospital has seen an 800% increase in children under the age of 10 ingesting cannabis, often toddlers eating gummies and other cannabis-infused products by mistake. See, now, you just tell me about all these fentanyl overdoses where people are dying and this mother's crying over this body and viewing, and then you tie it right into the first sentence of cannabis overdoses, 800%, children ingesting cannabis, and it's all by mistake, and you don't even say that nothing happened to them. You see how, like, these articles, this is the San Diego Union Tribune. It's a loaded article because how we're taught to speak and teach about cannabis has to be changed. Again, I'll keep on going. Every year, Huron gives an in-person presentation at the Coronado schools on Tuesday. Eighth graders Owen Ehrlichman and Anna Thomas told reporters his talks last year made them think more about the impact drugs have on people's lives. This presentation really showed me how even trying it one time or just saying yes one time can completely change your entire approach to life and your future, Anna said. Said Owens, it can really change your life, not for the better, but for the worse. This is basically like a regurgitation of the DARE program. The DARE program, I know everybody's familiar with it, was full of propaganda, misinformation, lies, unscientific statements. Complete BS. I will go online or go on record and saying right now, like, yes, we should make sure that we have safe, effective laws that prevent children from having access to drugs and cannabis and alcohol and cigarettes and all the things that can damage their bodies in development stages and cause harm and injury. We should definitely do that. Do not use cannabis as a child unless you are prescribed by a doctor. However, that is not what this stuff is about right here. These programs right here are made to, like, put a value system into your children at a very young age. And, like, there was even like conversations with kids around me by DARE officers, by other people in these type of programs, where they were actually telling you to tell on your parents if they had cannabis in the house. Like, this is not what we're supposed to be doing to the family unit. Education is key, but education should come from the family unit, and it should be instilled with the values that the family holds dear. That's what I'm saying for Wednesday. High at 9 News. It's your outlaw correspondent, Luke Scarmazzo, kicking it back to the correspondents. What do you guys got to say about this?
Here to teach teenagers has never worked.
Mhm.
And I remember, a long time ago, over 50 years ago, when cops would come in and tell you about drugs, we just turned them off. It's like, you don't know what the fuck you're talking about. Don't talk to us about this. You can't come in once a year and give a talk to kids and try to scare them not to use fentanyl and think that's effective at educating young folks about substances they're going to encounter in their world. They're going to see their family and friends use and what that means. They don't want to teach them honestly that only 25% of people who ever use heroin go on to have heroin addiction. I don't want to tell you that because that's not the message they want to put out there. And less than 10% of people who ever smoke pot go on to have anything close to a cannabis use disorder. Those are the kinds of discussions I had with my children and every one of their kids that would listen. Molly was a physician. We weren't afraid to tell you. This is the facts about it. The cops are out there to deal with law enforcement. They're not trained in medicine. They don't know what the fuck they're talking about. Let's have an ongoing discussion about sex, about mental health, about substance use, and offer services to kids who go, hey, I'm struggling with vaping. Well, let's not castigate them. Let's get them into some treatment. Or, hey, I like smoking weed. Can we talk about that? And have services available. It's all about punishment. And if you don't follow the line I give you that you need to be afraid of all this, now you're going to be on the wrong side of the law. And it's never worked. It never worked for me. None of my friends that had babies after taking acid had three-eyed children. You know, you can't lie to kids. This is an ongoing discussion we should be having with kids as they mature and are ready to talk about sex, mental health, struggles in the family, and of course, substance use and abuse.
I
Yeah, I
agree. It's really important that everybody talks about their kids with this, but not everybody does, right? And most people are not equipped with the right tools. And so we're always stuck in this like tail chasing circle where, like, for example, right now we have a law enforcement officer who's putting these videos out, right? Or an agency that's putting these videos out. And I'm sure this is their attempt at doing what's right? And trying to be helpful and managing with the small amount of information that they're probably choosing to look at when they're putting their presentation together. It's just, it's, I know we sit in judgment a lot. It's like people are making an effort, we also need to encourage them for the effort while also coaching them more, right? And making
mhm.
sure that when people in the industry come across an opportunity to interface with law enforcement individuals who are supportive or trying to educate about the cannabis plant, that we engage with them about how they're doing it and get into the methodologies and the material, the content that they're putting out, offer assistance, offer to be their education source.
You know what? You bring up a very good point, Mandy, and I wish some of these social equity programs created or funded for basically a community person that would go into those local police departments to re-educate those officers in regards to what would be correct cannabis policy. And I think social equity advocates and whatnot should really take
I
that
mean,
into
it doesn't even need to
consideration.
be social equity. Other
Well,
amazing educational
So
institutions
I'm
like
saying
Oaksterdam
that's
actually,
that yeah, well.
Oaksterdam actually offers something like this to law enforcement agencies. They will come in and train their staff
Hmm.
and
I want
provide
the, I
all
want these,
kinds of educational material.
That's what I'm saying. But what
So
I'm saying is when they pass these laws, that there should be some type of government funding that provides these types of resources to pay for that type of education.
absolutely.
yeah.
Absolutely. It should be a part of a law enforcement agent's continuing education. The
Hmm.
same thing with attorneys and doctors and really anybody who interfaces with the general public. They should be required to get educated. I can't believe we still have the majority of doctors that are writing prescriptions and seeing patients as we speak don't even know about the endocannabinoid system. Like this, there's so much education that needs to continue happening. And, you know, I fucking say it all the time, but we're never going to get to take off our teachers' hats when it comes to this plant. You don't get to get tired. You don't.
Hmm.
Right.
And
And
just to be clear
education is
too,
always it's always evolving, and I just want them to tell the whole truth, right? Tell them the whole truth where they're getting this information. If there is an agenda, tell the whole truth, give the whole education behind it, and you're like, oh yeah, this stuff is in common pharmaceuticals. You know what else is? Opioids.
Hmm.
You know,
Exactly.
a lot of these doctors are putting stuff on you that are getting you guys addicted to stuff too. But when you go out there and you tell, like, oh, I choose a drug-free future, like, what does that mean? And why are you even telling these kids, like, don't do something? Why don't you tell them, like, this is what this does? This is the effect that it has on its body, on your body, and this is the negative results. These are the positive results. Like, I want to have like more balanced conversations from these educators rather than them coming in with their own agenda that's more often than not is not backed by complete science. You might have like this is a great example of pseudoscience, right? You're just telling all the bad stuff and you're not telling the good stuff, right? You take too much sugar, you can end up with diabetes, right? You don't get in those conversations, and you're giving these kids like horrible lunches, right? And you're putting them in situations where in a school that are dimly lit, that look like a hospital, that look like a jail, and these teaching institutions, and they go out and they learn whatever they're meant to learn out on the streets. They're not going to trust you.
Hmm.
And once they find out that you lied to them, how do you think they're going to view police officers in the future? Right. I love breaking
Yep.
down these conversations with, because, Dare to keep kids off drugs, they rebranded it and everything. I saw this fool outside the grocery store a couple months ago tore his ass apart because he's like, yeah, we're just about education. Like, nah, man, like this is a bullshit. It's a bullshit program. You fucked up a lot of kids' upbringing, and you lied. And now you just try to reskin yourself and try to be something else. Like, nah, man. Like teach kids. If you want to teach kids, especially in the educational format, if you want to be in classrooms teaching kids stuff, teach them the whole truth and promote their exploration to learn more on their own. Like, like this is it
Yes.
pisses me off. Fuck pull my
100%.
kid out.
And I agree, Rico. And the crazy part is the data that they come with is most of the time funded by agencies that will only accept data that is negative. You know what I
Mm-hmm.
mean? So like a lot of times they have this slew of data and this research and this clinical trial and this survey, right? But all of those were funded by like the Drug Abuse Prevention Agency, right? And they had a directive like, hey, look, we're not looking for any benefits. This is not what this study is about. We want to know the negative effects, and that's what we want you to report. So there, it's very skewed, like you said. And just to be clear, like I'm not disparaging Mr. Haran or the low-level person who's actually trying to do the education. Like he's just a pawn in this thing too. Like when I'm talking about these institutions, I'm talking about them as a whole and their culture and what is taught, and then their strategic uh, uh, marketing, I guess, for lack of better words, of how they want to put it out to the world and make themselves look and make the issues that they represent look. So it's not
Yeah.
necessarily the worker's fault at the ground level. He's just doing what the culture has already brainwashed them to do. But what we do have to do is we have to start back at the beginning and say, hey, look, what was taught to you was not correct in the first place. We want to come back to the beginning and teach from a scientific, factual perspective of what the harms and benefits of this plant can be and educate in the right way. And then we can be partners in this education rather than just giving your slanted propaganda about how bad drugs are, tell on your mom so that we can put her in jail and start the industrial complex once again.